A physical one to keep in mind is you're more susceptible to illnesses and diseases. So you're more likely to get sick, more likely to get diabetes, more likely to get cardiovascular disease, and also mental disorders too, like major depressive disorder or some type of anxiety disorder. And this is on top of post-traumatic stress disorder. When I say a major trauma, not everyone that goes through a major trauma will develop post-traumatic stress disorder because some people are more resilient than others. Resiliency is kind of like the ability to bounce back, quote unquote, the ability to begin to regulate yourself, regulate your emotions, engage in self-care and things of that nature. So some people have a higher resiliency or stress tolerance than others. Something that has been coming up a lot in social media is complex PTSD or CPTSD. So while this is not an official diagnosis, this is something that a lot of researchers in different areas like counseling, psychology, and social work have done studies on and kind of compared complex PTSD to general PTSD. So CPTSD is something that comes up when a trauma is repeated or lasts for many years. So a one-time thing like a car accident or a single rape would usually not result in CPTSD because it can be, I don't want to say more easily treated, but maybe more targeted in treatment. But when there is a cluster or network or web of events, it's a lot more difficult, well, I don't want to say difficult, but maybe more time-consuming and effortful to get treatment. So it is still very much possible, but it might require more work and more time. Some have suggested that the current PTSD diagnosis does not fully capture the psychological harm that happens with prolonged trauma. Things that get affected, very much similar to general PTSD, are emotional regulation, so the ability to manage our emotions, manage our stress, manage our anger, our anxiety. Consciousness, so being able to be present, to think, to concentrate. Self-perception, what we think about ourselves, how we talk to ourselves. Are we feeling I combine the two, guilt and shame about what happened to us? Are we blaming ourselves? Is it really, do we feel like it's our fault, even if it was someone else that may have done something to us? Are we blaming ourselves for that, for someone else's choice? Distorted perceptions of the perpetrator. So this kind of goes with what I was just saying. Perpetrator meaning the person that causes the trauma to you. So sometimes, in certain cases, we might feel a need to protect the perpetrator or to kind of glorify them, which is an adverse reaction to what they do to us. Relations with others, and one's systems of meaning. So that is like how we give life meaning, what we think is meaningful, what provides us with some sort of purpose. That can be skewed as well when trauma happens to us over and over. Even things like spirituality might question things, like maybe you were a person of faith and then a severe trauma happens and now you're questioning, well, is there a God, or why did this happen to me? How could this happen to me? So that's something else that can be impacted. There is something called the Adverse Childhood Experiences Study. I did print out some information about it. I don't expect you to fill it out, However, I do want you to read over, thank you. I do want you to read over the different things included in the study. So I'll go ahead and list some of the key points of this. So adverse childhood experience is something that happens to us before the age of 18. Over half of adults in the U.S. have experienced at least one of these, and there are 9. And nearly 1 in 6 adults, which is almost 20%, had reported that they have at least 4 or more type of adverse childhood experiences. Preventing these can potentially reduce many health conditions. So as I stated earlier, trauma can affect us physically and mentally when it comes to illnesses and diseases. One hypothesis that they have is by reducing or preventing these things, up to 2 million heart disease cases and 21 million depression cases potentially could have been avoided. So that's a very major impact right there, just showing how reducing these things, preventing these things, or getting treatment for these things can help reduce a lot of these illnesses and diseases that are present today. Some people are at greater risk than others for ACEs, depending on things like race, socioeconomic status, gender, etc. Does anyone have any questions about this? Okay. So now I'll shift to the types of treatment for PTSD or trauma in general. Sometimes someone might not meet criteria for a diagnosis of PTSD, but that doesn't mean that the trauma isn't affecting them. You can still have some of those symptoms on there. You might have 5 symptoms, and I think you need like 6 to be diagnosed with it. Or you could have 2 to 3 symptoms, and that is still something that can impact us. But it's not about having the diagnosis formally. It's about treating those symptoms and what caused, kind of like what caused those things within ourselves. So first I'll talk about therapy a bit. General talk therapy, so that's like going to someone, talking about what's happening, how it affects you, and receiving feedback about it, essentially. We also have exposure therapy, cognitive processing therapy, trauma-informed cognitive behavioral therapy, EMDR, which stands for eye movement desensitization and reprocessing, and support groups. We also have medication. The purpose of medication is to reduce the symptoms that are occurring. That way we can focus on targeting or treating what is going on, to be able to think and process without getting too overwhelmed that you shut down or disconnect. So it's to help you be able to engage in treatment more fully. Because these symptoms can be debilitating. Some people with PTSD even qualify to have it as a disability because it is so complex and so impactful to our daily lives. Well, the first one I'll talk about is exposure therapy. So prolonged exposure is a type of cognitive behavior therapy that teaches individuals to gradually approach trauma-related memories, feelings, and situations. Most people want to avoid anything that reminds them of the trauma they experience, but doing that actually reinforces the fear. A person can decrease symptoms by actively learning that the memories and cues are not dangerous and do not need to be avoided. I also put virtual reality therapy up here. That is something that is often used by the Veteran Affairs to treat individuals who have combat-related, combat-related trauma. So kind of like you put like the goggles on, and it simulates an event, and you're supposed to use like coping skills and things of that nature, and things that you're learning in therapy to help you stay engaged longer and longer over time to where it doesn't bother you as much. If that makes sense. Then we have cognitive processing therapy. So this takes about 12 sessions at least with a therapist, and it's important that it is completed in full in order to get the best effect. So it helps to reduce PTSD symptoms. People learn how to challenge and modify unhelpful beliefs related to the trauma. Some examples of unhelpful beliefs are, I am not safe, I am in danger, it is my fault, and things of that nature. TFCBT is used with children and adolescents who have experienced different types of trauma. It typically includes the caregiver in certain parts of the process, so the caregiver is also educated on what's going on within the child or adolescent. It teaches the caregiver coping skills while the child is in therapy receiving the different types of techniques and coping skills in order to help overcome the traumatic event. There's also an exposure component to this, and where the child creates a way to essentially release the trauma by creating a trauma narrative. So in exposing them to the trauma in whatever form can help them desensitize the impact of it. So it's a very collaborative thing between the therapist, the child, and the caregiver. But a caregiver is not always necessary. It's just proven to be more beneficial that way. So it includes different things, kind of like from the cognitive processing therapy. It includes a family component and other techniques. So this is something that is widely used by children's advocacy centers, which primarily deal with children and adolescents who have been through some sort of abuse, whether physical, emotional, sexual, or things of that nature. And then we have EMDR. So this is a structured therapy that encourages the person to briefly focus on a traumatic memory while simultaneously experiencing bilateral stimulation. So this is kind of not necessarily newer. I think it came out in the 80s or 90s, but it's more recently become, I want to maybe say the word popular or more well-known than it used to be in the last 10 years. This is a very, very, very effective form of therapy. Even Veteran Affairs has approved this as a form of treatment for PTSD. So it can help a lot of different type of disorders and traumas. It doesn't necessarily just have to be trauma. It can also be used to treat anxiety or other things. So I'm biased because I really believe in this one. Other treatments include things like trauma-informed yoga, spiritual practices, breath work, meditation. So there are even some studies that say cannabis can be helpful to relieve symptoms, but then there are other studies that say, well, yes, they relieve them in the short term, but in the long term, it actually makes it worse. And then there's that substance use dependency component. So that one's controversial. Psilocybin, also known as shrooms, is another controversial treatment for PTSD. Some studies say that it can be used once and it helps to regrow certain parts of the brain, but for others, it can be a negative experience or a bad trip. and it can actually worsen PTSD. So this one's controversial. So there are different universities doing research with both of those drugs currently. I don't recommend it, but that's a bias that I have. How do you support someone with trauma? I mean, the most important thing is to listen and be there. You are not a therapist, so while yes, you can help and give advice and listen and, hey, let's practice this coping skill together. Those things are all great, but when it comes down to it, someone with trauma or PTSD does need help from a professional. Be patient and have fun. I put have fun on here because not everything doesn't always have to be serious when someone has gone through something serious. People want to go out there and do something that's fun. They don't want to think about it all the time or be focusing on it all the time. But it's also important to make sure, or to help them not avoid it. So everything has a gray area. It's not always black and white. Here are some resources that provide information about PTSD. So while they're not resources to can necessarily get help from, they do have a lot of info and educational pamphlets, PDFs that you can print out or send to someone so they can read over. One of the most important parts of trauma is education. If you don't know why something is happening to you, or why can't I sleep, or why do I keep thinking about this over and over, or why am I always tense? If you don't know what's happening to you, it's much more difficult to understand and to get that help. It's much more difficult to cope with it. Okay. These are some local resources. So MHMR of Tarrant County is a mental health company that provides assistance with a wide variety of mental health and intellectual or developmental disabilities for all ages, from infants to the seniors. They also have a military or veteran office as well. So they help with a wide variety of things. And they also have medication. And I put this one up here because you don't have to have insurance for this. All these therapy treatments that I mentioned are great, but if you don't have the funds or the financial resources or insurance to get that help, then it sucks. So I put this resource up here because you don't have to have the finances or the insurance to get help. You might have to wait a little bit because they are very busy, but waiting and getting that help is way better than not doing anything. Alliance for Children, that is who provides the TFCBT that I mentioned and the EMDR for children and adolescents who have gone through some sort of abuse or trauma. Veteran Affairs, and then we have short-term counseling here at TCC. So you can email or visit that link, and you can schedule an appointment. So tell your fellow students and colleagues about it. They might not know. If they're a TCC student, they can access that. But that's it. Do y'all have any questions?
So, as faculty or staff, how would you suggest we direct students to the resources, especially that we have here on campus, without crossing the line? Let's say we might think they would benefit from the resources we have, but how would you suggest we let them know about it in the street manner, whatever you think?
Okay, that is an excellent question. I would say there's not a specific way, but the most important thing is to just give them the autonomy and empower them to make an appointment. So you can tell them, like, hey, we have counseling here. I don't know if that's something you're interested in, but I can email you the information. And if you want to make an appointment, you can, or it's completely up to you. So I would phrase it that way. If it's a student that you think might benefit from you walking them through it, you can do that as well, but don't make the appointment for them. Make sure that they're the ones sending the email, or they're the ones filling in the information or making the phone call. You can be there with them. I don't know if does that answer your question?
Can I inform that as a student and somebody who has gone through therapy on how I would want for you to pursue? And how I would want somebody as a student to like address it to me is maybe have like a flyer with like the information for counseling. Or as a professor, it would be appreciative for like a professor to say at the beginning of the semester like, hey, college is tough. We have these counseling resources for you guys that need it. Because therapy is also expensive. Counseling is expensive. So there are these resources. And in terms of like the library, just making it known that, hey, we have information here with the resources for anybody that needs it. Because college is tough. School is tough.
Thank you. Yeah, I definitely always appreciate the student perspective. Anything else?
Yeah, I have a question. Can we get that PowerPoint email to us, like to the student ID that we checked into?
Yes.
Get that, you're Mr. Beaver?
No.
I would have
I'll
to email them?
yeah, I'll talk to you in a little bit, and I'll get your email.
Oh, okay. Am I in trouble?
No. Any other questions? Well, thank y'all for coming.